According to the Dangerous Drugs Board of the Philippines, from the years 2002 to 2013, around 80,000 pushers and 66,000 users were arrested. The pushers and users who were arrested in this 11-year period total to 144,000. In June 2016, the government administration changed leaders. According to the Philippine National Police, since July 2016, around 800,000 drug pushers and users have surrendered. 800,000 in 5 months is around 5.5 times more than 144,000 in 11 years. The 800,000 who surrendered is made up of around 57,000 pushers and 743,000 users. According to a news article from Rappler, in the past 5 months, around 1,900 suspected drug personalities have been killed in police operations. Around 3,000 have been killed in vigilante-style killings. The total number of people killed is around 4,900. People killed involve drug pushers and users. This is the drug in the Philippines today. 5 months, almost 5,000 dead. Why are all these people being killed? In official police operations, the police says that those who end up dead retaliated against them. For the vigilante-style killings, the picture is murky. There have been allegations that these are extrajudicial killings, that the police is killing these suspects secretly. However, the government denies that it is behind these killings. The Philippine National Police has been investigating these deaths. Around 400 suspects have been arrested. The drug war is a massive bioethical issue. On the one hand, illegal drugs are a problem, and you want to be rid of the problems that drugs generate. But on the other hand, what are the effects of this drug eradication effort? Thousands of dead people, including fatal casualties. Innocent people caught between the police and drug pushers and users. Government funds and human lives are spent. This is the ethical dilemma. Do we want to be rid of drugs and accept the bloody consequences? Or do we avoid these consequences but still have the effects of drugs in society? In bioethics, one approach that can guide us in an ethical dilemma is the use of bioethical principles. These principles are respect for persons, beneficence, non-maleficence, and justice. The 4 principles have been endorsed by various international documents and organizations. What can the 4 principles tell us about the ethical dilemma in the war against drugs?
The principles of beneficence and non-maleficence are related. Beneficence dictates that doctors or health professionals need to do good things or beneficial things to patients or research subjects. Non-maleficence dictates to do no harm. Therefore, in any course of action, there has to be a favorable harm-benefit ratio. What is ideal is for harm to be minimized and benefit to be maximized. Does the drug war present a favorable harm-benefit ratio? Nearly 5,000 have died. This is clear harm. But maybe these deaths can be for the greater good. Maybe because of these deaths, future harm can actually be prevented. After all, drug pushers and users are a strain to any nation. A drug user will do anything to finance her vice. She will steal, kill, commit other crimes to get her drug of choice. A user's demand for drugs can be extremely insatiable, and this insatiability is something that drug pushers exploit. Drug economies are extremely lucrative. Drug cartels and massive organized syndicates exist to supply and circulate drugs. Sometimes, these organized groups can fight among each other to control certain territories. These turf wars can be bloody. Such is the chaos that the desire for drugs can fuel. But all this chaos can be nothing once the users feel euphoria from their drug of choice. And when users are high, they become less inhibited to do other crimes. Drugs are clearly harmful. It is this harm that any government spends millions in money and manpower to eliminate and prevent. Money and manpower are spent on anti-drug use educational programs, police operations against drug-related crimes, and rehabilitation of addicts. If drugs can be eradicated, then all these crimes and the money and efforts against it can be eliminated. Society will clearly benefit from the disappearance of drugs, but at what cost? Is clearly 5,000 dead worth it? Maybe, but the death toll will continue to rise. The problem with the drug war is that what is being addressed is the supply of drugs. In killing pushers, the aim is to decrease the drug supply. However, this course of action has been proven to be ineffective in other countries. Why? Because the demand for drugs will most likely stay the same even if there is less supply. As has been pointed out, a drug user's desire for drug is so strong. If, for instance, drug syndicates get eliminated, the supply for drugs can decrease for a while. With this decrease, price will increase. Some users will continue to find ways to get her supply even if the price increases. She can steal more money to get the more expensive drug, or she can find cheaper drugs to consume. In addition, if a syndicate gets disbanded, another can replace it, even syndicates from other countries. After all, drug trade is international. The supply of drugs in one country can come from another country. The war on drugs will be bloodier as syndicates adapt more to police operations. They will find ways to retaliate. Violence begets violence. From a harm-benefit perspective, a drug war is a losing war. People will continue to die, but drugs will continue to exist. Is there another solution? Yes.
If the supply of drugs cannot be eliminated, then perhaps the demand can be decreased. Demand can be decreased by intensifying education and rehabilitation efforts. Education is vital, especially if the usual profile of a drug user in a country is one of low educational attainment. Rehabilitation is vital in curing drug addicts. Addicts, after all, are patients. Addiction is a disease. Substance use disorder is a psychiatric diagnosis according to the DSM-5, or the fifth or latest iteration of the Diagnostic and Statistical Manual of Mental Disorder. The DSM is the manual that psychiatrists, psychologists, and other healthcare professionals consult in diagnosing patients. Addiction is a disease, and the disease needs to be treated. Those suffering from addiction or on substance use disorder are sick patients who need treatment. Patients get medical attention, not a bullet through their head. Through rehabilitation, demand for drugs can be decreased. If the demand is less, then even if there is a supply of drugs, drug sales can be lowered. Drug pushers and syndicates will have decreased profits. Education and rehabilitation is the key to anti-drug solution and has a favorable harm-benefit ratio. With this solution, the bloody deaths in the drug war are eliminated. But even more than complying with beneficence and non-maleficence, focusing on rehabilitation actually complies with the principle of respect for persons. One philosophical foundation of the respect for persons comes from Immanuel Kant. In Kant's groundwork for the metaphysics of morals, he says, all humans have a capacity for reason. This reason is something that objects do not possess. Because humans have reason, they should not be treated as mere objects. Humans need to be respected because of their reason. When humans, even addicts, are killed in a drug war, they are being treated like objects without reason. When humans are treated as means to an end, then their personhood is not respected. When addicts are killed as a means to the end of eradicating drugs, the personhood of addicts is not respected. Killing people in a drug war does not comply with the principle of respect for persons. With rehabilitation, this ethical violation is eliminated. Thus, rehabilitation does not only comply with beneficence, non-maleficence, but also respect for persons. Finally, what about the principle of justice? One aspect of justice is the distribution of scarce resources in patient treatment. This principle can be generalized to other courses of action. The course of action is the eradication of drugs. How should scarce government resources like money and manpower be spent? These resources should be spent effectively. Why spend all this money and effort on a drug war that has not been proven to work? The drug war is unjust and ineffective. Rehabilitation is the strategy that works, and resources should be spent on this course of action. The bloody drug war in the Philippines does not comply with respect for persons, beneficence, non-maleficence, and justice. It is clearly unethical. With the analysis, would you say yes if given the power to kill a drug addict in front of you?